Hello everybody, how are you? Thank you very much for watching my previous video about the MRCS study with me. Welcome to back again to my new playlist. So you all know that I am doing the online teaching for about 4 to 6 months or 1 year, but some of you saw that I really did teach about FCPS and MRCS. So though I'm preparing for myself for part A exam, so study with me is one of the important tactics, so that we can co-regulate with each other, along with we can discuss as an online media. So here today I'm going to start the first sessions. I hope you will join with me. You will see my videos time to time, so that you can enrich and build knowledge about the MRCS basic topics, because basic is very important. Whatever they make any questions, but whatever they try to assess, but if you know the basic, if you know the very most virtual phenomena, if you want to make 80% score, 75 to 80% score, you need a proper minimum knowledge about the surgical anatomy, physiology, pathology, microbiology, and the other subjects. That is POA is the exam, that is principal practice of surgery. In that case, you can see here as a part A notes that I'm just started, the radar notes. I already gave you the instruction about the study materials in the previous video. Here you can see the radar notes. It is a very fundamental things, that is the subjective anatomical knowledge and the physiological knowledge, along with some pathology. So these three things: anatomy, physiology, pathologies, and the microbiology. So these four subjects quite together is called the ABS exam, that is applied basic science. So let's start with the upper limb. So here the acknowledgement EMRCs is our basic needs, but the contents of these notes is gathered from the Gray's Anatomy, that is student copy. The pictures is taken from the Gray's Anatomy student copy, and the clinical parts comes from the Data Anatomy series as well as Wikipedia. Okay, let's go through the first things about the anatomy of head neck. No, but today I'm going to start the first I will start with the upper limb. So here it is, upper limb. So what are the topics of upper limb is necessary? First we must know that, because in the textbook I already said that no need to go through any textbooks, because textbooks is very vast, very wide knowledges, because these textbooks is usually made for the anatomy post PG students, not for surgeons. All the topics is not needed for the surgery. You must go through the basic fundamental things, which is go through the surgery. Surgical anatomy, that is upper limb related with surgical anatomy, is very important, because in the surgery there are important media, or there is an important branch of orthopedics and traumatology. Okay, so they will be very skilled about the anatomy first and the physiology. But we all know, maybe you don't know, that the MRCS is one of the important fundamental degree of orthopedicians outside our country, like UK, USA, like UK, like Australia, like the Middle East. They usually do MRCS because it is very much needed for entry level of PG exam. So let's start. First topic is anatomy about the upper limb. So here we need, that is bones, What are the bones? Basic bones are composed of upper limb muscles of upper limb and the arm, forearm. Okay, so muscles. Okay, now the retinaculums, compartments, then neuroanatomic relationship of the forearm, then muscles of the hands and wrist, and hand anatomy, because there is a topic of hand anatomy. Okay, so in few days I will make another video about the syllabus. That is, there is a syllabus about there is a syllabus for MRCS, that is how many questions will come to the anatomy, how many questions come from the physiology or pathology and other subjects. I will discuss within very short time. Okay, now the arteries, veins, nerves, that is vascular supply or supply of the upper limb is another important things, and then the joints. Okay, joints and importance, clinical space or clinical fundamental positions, like here the retinaculum, like palm, like elbow, like axilla, like neck, that is brachial plexus along with. So their supplies is very much necessary for specific upper limb. That is limb. There is a 15 to 14 15 questions will be come from the limb. Okay, so we must be very conscious about the limb. Okay, so let's go through first the bones. This is the bones. This is the clavicle, acromion, scapula, and the humerus. Okay, this is the posterior surface. This is the ventral surface. This is the dorsal surface. So you all know that is the deltoid neck, anatomical neck, and the spinous acromial angle, and the scapula, supraspinous fossa, infraspinous fossa. So here the muscle attachment, the second things, that is bones along with muscle. Then the important matters along with the attachment of the muscles, that is trapezius, deltoid, pectoralis major, minor, so these kind of things. So I hope you have to go through these pictures. If you want to see the very good quality pictures, then you have to go through the nature anatomy. So this is the elbow joints, flexor aspects. This is the extensor aspects. So joint, this is the lower end of the humerus. This is the radius, head, ulnar head. Okay, tuberosity. So this is the elbow is flexed conditions. So this is the articular surfaces above the ulna, radius, and their attachment, fibrous ligaments. So this is the picture of nature. This is the nature picture. And they are the muscular supply. So this is the muscular supply of extensor region. Now this is the bones, proximal distal bones, that is trapezium, trapezoid, capitate, hamate, and the scaphoid, lunate, triquetrum, pisiform. So proximal and distal lumen is one of the important factors that we must know. Now the muscle attachment. So muscles of upper limb, the second topic. Trapezius, this is the very important muscles. Okay, I'm going to highlight the specific nerve supply along the muscles and important parts. So you must focus on where I'm going to highlight. Okay, so first is trapezius. Okay, trapezius, it's the muscles of the neck which helps to elevate the shoulder. Okay, so it is cranial accessory nerve. We know the cranial accessory nerve. So here the trapezius, cranial accessory nerve is very important. Another one is the latissimus dorsi. It is called the climber's muscle. In case of monkey, latissimus dorsi is very strong in that case. And the thoracodorsal nerve, which is called middle scapular nerve, if it also called upper, middle, lower. So middle scapular nerve, thoracodorsal nerve also called. Then the pectoralis major and minor, major muscles, pectoralis minor muscles, these are the supplied by medial pectoral, lateral pectoral. Then the medial and pectoral nerve. Then the serratus anterior, which is supplied by the long thoracic nerve. Okay, so serratus anterior, you know that there are some transverse muscles which is seen in case of bodybuilder person. So that is a long thoracic nerve. Remember that, because it prevents winging of scapula. So some questions asked like this, that what nerve is lost or injured, that's why winging of scapula occurs. So that is long thoracic nerve. And which muscle is responsible? Serratus anterior. Okay, it also helps in abduction of the shoulder joint. Now the deltoid is supplied by axillary nerve. It's very important. It is also an abduction of the arm above the 90 degree. Above the 90 degree, when up to 90 degree, that is supraspinatus. Then above the 90 degree, that is deltoid, or extensive upward movement of the shoulder, which is done by serratus anterior. Now the teres major, by lower scapular nerve, subscapular. So middle subscapular is thoracodorsal nerve. Subscapular. So this is the rotator of calf muscle. One of the important 3-star things. Okay, that is rotator cuff. That is subscapularis. Okay, subscapularis. Very, very important. If I said it, so I have to say that it's very important for MRCS exam. Okay, very important. So try to recapitulate it. Okay, subscapularis, supraspinatus, infraspinatus, teres minor, not major, teres minor, supraspinatus, infraspinatus, subscapularis. Okay, subscapularis, subscapular nerve, upper and lower subscapular, not middle subscapular. Okay, there are 3 kind of subscapular nerve. Upper and middle subscapular nerve is supplies to the subscapular muscle, which is helps to rotator cuff, which is a component of rotator cuff. But the middle subscapular nerve is also called the thoracodorsal nerve, which is supplied to the nerve to the latissimus dorsi. Okay, now the supraspinatus is called suprascapular nerve. Infraspinatus is also from the suprascapular nerve. Teres minor is by the axillary nerve. Okay, remember, teres minor supplied by axillary nerve. Teres minor, deltoid, same nerve supply. So subscapulary, supraspinatus, infraspinatus are supplied by the same nerve supply. Suprascapular, upper and lower subscapular. So here are the pictures from the Gray's Anatomy student copy. So here you can see the muscle trapezius here, that is a diamond shaped muscle, rhomboid major, rhomboid minor, latissimus dorsi, and the deltoid, pectoralis major, minor, and others. So the pattern, see the pattern of the muscles, where it present, where they are attached with the surrounding structures, and go through. Okay, so here you can see the two important foramen or space, that is the quadrangular and the triangular foramen. So the content of quadrangular and triangular space is sometimes asked in the exam. So this is the deltoid, this is the trapezius and spine. Okay, just make it remember that these muscles are nerve supply and their attachment is very much important for MRCS exam. Now the muscles of the arm. Now this is the neck complete. Now the arm. What are the muscles in the arm present? So there are 3 important muscles. First, this is coracobrachialis, biceps brachii, and the brachioradialis. There are 3 things, BBC. It is also called the BBC. If I say here, that is BBC. Coracobrachialis, biceps brachii, and the brachioradialis. So biceps brachii, brachialis, coracobrachialis, BBC. Those 3 muscles are supplied by musculocutaneous nerve. Musculocutaneous, and the musculocutaneous and the radial nerve. So there is a dual nerve supply. Brachialis. So it has been confusing somehow when you will solve the EMRCS. There will be a confusion that brachialis is supplied by musculoskeletal, you know that, but it is also supplied by the radial nerve, because brachialis, it's also called the brachioradialis. That's why it is sometimes mimicking, because brachialis is also called the brachioradialis. So there is one end which is attached with the fibrous joint of the radius, where the radius is attached with the ulna and the capitulum. In here the brachioradialis is inserted. That's why it is not only called the brachialis, so brachium consists of, but also it also present with the fibrous joints of the radius. That's why it's called the brachioradialis. So there is a two nerve supply in single muscle. Now the triceps brachii. Triceps muscle, which is one of the important muscle of extension of the elbow. So a extension of the forearm, okay, elbow extension, main muscle is supplied by radial nerve, okay, and the radial nerve and the blood supply is profunda brachii artery. It is the one of the largest branch of the axillary artery, okay, the largest branch of the axillary artery, profunda brachii. That is, it is arises from the third part of the axillary artery. There are three part: first part, second part, and third part. That is, profunda brachii artery arises from the third part of the axillary artery. Try to remember that first. So here the scapula, you can see the two things: short head of triceps, tip of the coracoid process, and the long head of the biceps brachii. The short head come from the short head of biceps come from acromion process, and the long head of biceps try from inferior glenoid cavity. এখান থেকে আসে. This is called coraco things. Now the compartment of the forearm, that is two groups, flexor group and the extensor group. So their flexor group means this is the flexor, what I have seen in the dorsum. If I stand like this, so this is my flexor aspect here, this flexor aspect. So flexor aspect is sometimes consist of pronator teres, flexor carpi radialis, that is, if I move strong, this is my radius, so the tendon here is called the flexor carpi radialis, okay. Now the prominent two tendon is called palmaris longus, okay. So pronator teres here, present here, pronator teres, then flexor carpi radialis, palmaris longus, then ki flexor carpi ulnaris. So ulnaris, palmaris longus, flexor carpi radialis longus. So this muscle is very important, and their locations, and the flexor digitorum superficially, as we are discussing about the superficial muscles, not deep. That's why superficialis must be denoted, that is flexor digitorum superficialis. So these muscles arises from the same origin, that is medial epicondyle. It arises from here, and it present as a bundle manner. They will act as a bundle manner. All together will act as a flexor aspect, flexion of the forearm, okay. The pronator teres is supplied by median nerve, very important, and the palmaris longus is also median nerve, and the flexor carpi radialis longus also median nerve. But flexor carpi ulnaris, because you can see here the ulnar things is denoted, that's why it's called ulnar nerve, and the superficialis, digitorum superficialis, is called median nerve, okay. Superficial to the median nerve it goes through, that's why. So see, the ulnar nerve present behind the medial epicondyle. Sometimes it is problematic, okay. And now the deep flexor of forearm. I already discussed about the superficial muscles, but now there is underneath the superficial part, that is deep part. So there are three important nerves which is supplied by the interosseous nerve, which is a branch of median nerve. So here you can see the median anterior interosseous, because interosseous nerve has a peculiarity, because it is derived from two important origin. One is gathered from the median nerve, that is the median portion, another one is from ulnar portion. Okay, ulnar and medium both are called the anterior interosseous. Anterior interosseous from the ulnar nerve, another parts, that is medial part, and another one is the anterior interosseous to the median part. Okay, when I stand here like this, some anterior interosseous nerve supply the ulnar, that is medial portion, another one is supplied to the lateral portion. So flexor digitorum profundus is supplied by median anterior interosseous and all the ulnar nerve. Flexor pollicis longus, pronator quadratus. Pronator quadratus supplied by medial anterior interosseous nerve only. Okay, just remember, median anterior interosseous nerve. Flexor pollicis longus. Pollicis mean the thumb. Pollis is the thumb. So flexor pollicis longus. The you can see the flexor pollicis present in the lateral aspect, which is supplied by median nerve. That's why the anterior interosseous branch of the median nerve here from the lateral one. That's why flexor pollicis longus is median nerve. But flexor digitorum profundus, which is arises from the medial epicondyle, it is also attached deep to the superficialis. As you know that superficial muscles supplied by the median nerve, but deep muscles supplied by the, where it goes, man. Let me see. Sometimes it is been go through this. Here, the digitorum profundus is also ulnar nerve. Okay, ulnar nerves. Sometimes it's necessary. And the, so try to remember these things is very important. Now the I already discussed about the flexor. Now the extensor surface, the things you saw here in the outside the flexor aspect is called the extensor aspect of the forearm. So forearm consists of brachioradialis. Okay, extensor carpi radialis longus. Here, extensor carpi radialis longus, extensor carpi radialis brevis. Longus and brevis, they are attached with each other. So extensor carpi radialis brevis. Then anconeus present here. The things, the tendon comes from here, which is prominent. It's called anconeus. Here the muscles, anconeus muscle here present in this place. Then extensor digitorum. Then extensor digiti minimi, that is it supplies to the digital substances. And extensor carpi ulnaris, there is ulnar region, some things present in the ulnar region. Okay, now the extensor carpi radius longus, then brevis, then anconeus, then flexor longus brevis. Brachioradialis present here. This is the brachioradial muscle, brachioradialis. Here this is called brachioradialis. Here you can see the brachioradialis muscle. If I say to you here, this is called the brachioradialis muscle. Okay, then extensor carpi radius longus and then brevis, then anconeus, then extensor digitorum superficialis, extensor digitorum muscle, then extensor digiti minimi. Minimum small size muscle but gives supply to the digit, and the extensor carpi ulnaris, here the ulnar muscles. Okay, so this extensor muscle, which is maximally supplied by the radial nerve. Okay, because radial nerve is an extensor of the elbow joint, you know that. It is also has an branches which is called posterior interosseous nerve, which is also derived from radial nerve. Okay, so here the extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. In that, this is very important. Pencil. So sometimes it is very important. I already saw a question in the EMRCS. I always saw that. And extensor digiti minimi is important things, which is supplied by posterior interosseous nerve. Okay, I hope you understand my things. Okay, so here you can see the brachioradialis that I have shown you, and then anconeus, extensor radius longus, brevis. They are attached with each other, longus and brevis. Then this is the digitorum, so gives digits, supply to the digit, and the minimi, that is minimum muscles. Minimi means it gives supply to the little fingers. Okay, see, only supply to the little finger, extensor digiti minimi, that is here. I used to do this, that is digiti minimi, extensor digiti minimi, extensor digiti minimi, or extensor, I extends extensor digitorum muscle. Okay, extensor digiti minimi. I hope you understand my my concept that I wanted to show you. Okay, now the deep extensor, that was the superficial extensor muscle. Now the deep extensor muscle. First, supinator, that is supine here. Some things I used to lift up, this is supination. Then adductor pollicis longus, this is abductor pollicis longus. When I do this, abduction, adduction, so this is abduction. Okay, abduction, adduction, just remember this is abduction, adduction. So abduction pollicis longus supplied by radial posterior, that is here the abductor pollicis longus, this is pollicis, this is called abduction. Here the abduction, which is supplied by this area, radial posterior interosseous nerve. Extensor pollicis brevis, now the extensor pollicis brevis, which is supplied by pollicis brevis, also radial posterior nerve. Extensor pollicis longus and brevis present here, so it helps to abduction of the thumb. Now the extensor pollicis longus, that is extensor pollicis longus. There is a long muscle here, which is prominent, you can see here, this is prominent, this is called extensor pollicis longus. Okay, see, when I extend my thumb, there is a prominence of a muscle, this is called extensor pollicis longus. And the extensor index. So point out the any person extends extensor indicis. When you will saw this finger like this is called index finger, extensor indicis. It is also supplied by radial portion, so radial posterior interosseous nerve. Okay, I hope you understand. So here extensor pollicis brevis and the extensor pollicis longus, you see, this is the adduction appearance. Okay, another extensor indicis. So index finger, you see the extensor indicis gives supply to the index finger here. So these are the deep muscles. So supinator, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, then extensor indicis. So these are the deep muscles. It is supplied by posterior interosseous radial nerve. And the superficial muscles like this, brachioradialis, extensor carpii longus, brevis, anconeus, digitorum. Okay, I hope you will remember or recapitulate it by doing revision. Okay, now the retinaculum. So some are retinaculum is like a band like structure here present in the wrist. So, this is the extensor retinaculum present here, and then the flexor retinaculum. So some structures goes above the retinaculum, some structures goes downward the retinaculum. So here the extensor retinaculum, okay, that is here extensor band. What structure lies superficially is basilic vein, dorsal cutaneous branch of the ulnar nerve. So ulnar nerve goes above the extensor retinaculum. Cephalic vein, so two veins, basilic vein, cephalic vein, and ulnar nerve, and the superficial branch of the radial nerve. So radial nerve, ulnar nerve, and the two veins are goes above the extensor retinaculum. Just remember this, very important. And the extensor retinaculum thickening deep fascia stress across the back of the wrist and hold the long extensor tendon positions. It is so extensor retinaculum attached to the pisiform and triquetral medially. So pisiform laterally and triquetrum medially. Okay, so this is the pisiform medially, maybe. Oh yes, so there is two bones, sorry, pisiform and the triquetrum. So those are side medially, so medially attached with these two bones, and the laterally it end of the radius. So one of the part Laterally it is attached with the radius bone, and the medially it is attached to the tracheotomy and pisiform. Okay. Now there is 6 compartment. How many compartment present in the extensor retinaculum? So there is a compartment. Okay. Extensor retinaculum will if I transect here, I can see 6 compartment. So this it is sometimes asked in the MRCS exam. How many compartment present in the extensor retinaculum? So these are the diseases is used to encounter in the daily practice. But in compartment, you can see these muscles are present with each compartment. So here this is the pictures of compartment. So ulnar nerve, ulnar artery goes above the retinaculum. This is the retinaculum, and median nerve is within under the retinaculum. This is the bony curvature, and the flexor pollicis longus. It is also asked in the FCPS exam. I already saw one time with the FCPS exam. The flexor carpi radialis tendon within the retinaculum under the flexor pollicis longus. Flexor carpi radialis longus is within the retinaculum, and all the structures goes down. The profundus, superficialis, like superficialis here, and the profundus here. Okay, so this is the tunnel. Superficialis and profundus present under the retinaculum, and within it flexor pollicis longus, flexor carpi radialis longus, and this is the flexor pollicis longus tendon. So this is the you can see some extensor digitorum is one compartment. Now the another one is the extensor carpi ulnaris is a single compartment. Extensor digiti minimi tendons, ulnar basilic vein inside. Here you can see the extensor carpi radialis longus, extensor carpi radialis brevis, another compartment, and extensor pollicis longus is another compartment. But radial artery is also outside the compartment. Cephalic vein. So as you see, this basilic vein, cephalic vein, dorsal cutaneous nerve, ulnar nerve, and radial nerve, and goes outside. This is all. Now the related relationship of the forearm. So what are the structure related with the vital structure? That is one of the important questions. Radial, that is between brachialis and brachioradialis. So brachialis and brachioradialis, these two muscles, in between two muscles, radial nerve goes through. Radial, brachialis and brachioradialis. Posterior interosseous, that is splits the supinator muscle. It goes pairs the supinator muscles. Superficial radial between the brachioradialis and extensor carpi radialis longus, and the median means medial to the brachial artery at elbow. Ulnar, that is between the flexor carpi ulnaris and the flexor digitorum profundus. Okay, so flexor carpi ulnaris, flexor digitorum profundus. So you must remember that ulnar and radial at least. Now the between the flexor carpi ulnaris and the digitorum profundus. Radial artery passes between the lateral collateral ligament of the wrist joint and the tendon of the abductor pollicis longus and extensor pollicis brevis. It is star points, you must remember. The muscles of hands of wrist. Now hand and wrist muscles. So there are many small muscles here. So we will recapitulate. That is thenar muscle, very very important. Thenar and hypothenar muscles and their nerve supply. Thenar means this is the thenar muscle. Thenar muscle just lies under the thumb, that is called thenar. Hypo means under the thumb, that is hypothenar muscle. So this is the hypothenar muscle, and this is the thenar muscle. So what are the muscles and their nerve supplies? Let's see. Abductor pollicis brevis, opponens pollicis, flexor pollicis brevis, adductor pollicis. Here the median nerve, and median and ulnar nerve. So here flexor pollicis brevis is a dual nerve supply. Okay, try to understand. Flexor pollicis brevis has a two nerve supply. Adductor pollicis longa and opponens pollicis. Opponens loaf, it is also called the loaf. Let me see. L-O-A-F. So loaf. that is O2 opponents policies, then holo abductor pollicis longus and brevis. So this is abductor pollicis longus, opponents pollicis, then holo adductor pollicis and holo flexor pollicis brevis. So flexor pollicis brevis is here, adductor pollicis, opponents pollicis, and abductor pollicis brevis. Okay, it is also called loaf, which is supplied by the median nerve, so laterally present here. And the adductor pollicis is from ulnar nerve. It is very important. Adductor pollicis here, the adductor pollicis is important. Okay, now the hypothenar muscles. So abducted thumb, adduct and abduct. So abductor pollicis brevis, abduction of the thumb, and the adductor pollicis means comes towards the hand. Hypothenar muscle, that is palmaris brevis, adductor digiti minimi, flexor digiti minimi brevis, opponents minimi. So all the supplies of ulnar nerve. Okay, ulnar nerve. So these all are supplied by the ulnar nerve. All the hypothenar muscle, that is here, ulnar nerve supply everything's. Along with adductor pollicis and flexor pollicis brevis. So adductor pollicis brevis and adduction, all the adduction like this, adduction is supplied by the ulnar nerve along with some median nerve. Now hand. So there are 8 carpal bones, 14 phalanx, then holo intrinsic muscles, the lumbricals, that is small muscle, thenar eminence, abductor pollicis brevis, opponents pollicis, flexor pollicis brevis. Must remember thenar eminence. These are called thenar eminence. Abductor pollicis brevis, flexor pollicis brevis, and opponents pollicis. Hypothenar eminence is opponents digiti minimi, flexor digiti minimi brevis, and adductor digiti minimi. This is the fascia and compartment. So here you can see the palmaris longus. These are the palmaris longus, palmaris brevis. Fascia of the palm is continuous with the antebrachial fascia. Okay, so no need here. Short muscle, it is not it's not come to the exam actually it's not come to the exam at all. We just go skip it. Now the another important thing is anatomical snap box. Okay, very very important. If I say this is called very very important, very 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 important. Okay, it's very very important, so you must remember it anyhow. You must know that is the anatomical snap box. So this is the anatomical snap box. Here you can see the depressed area of the above the thumb, anatomical snap box. So there are 3 muscles, 2 present laterally, 1 from medially, and there is a triangular area which forms the anatomical snap box. It has some border, posterior border, anterior border, then what it is, distal border, floor or content. Okay, so content is a radial artery, first you must know, and floor is composed of 2 bones, scaphoid and trapezium. Scaphoid bone is usually ruptured or fractured, and avascular necrosis occurs. And the distal border, that is apex, the distal border here, 3 muscles united with each other. Here this is the distal border, apex of the snap box. And the proximal border is the styloid process of the radius. Here the styloid process, here this is the bony prominent area, this is the styloid process of the radius. And the posterior border tendon of extensor pollicis longus, the Wang muscles. Another one laterally, that is laterally 2 muscles, I already said, that is extensor pollicis brevis and abductor pollicis longus. So 3 muscles, abductor pollicis longus, extensor pollicis brevis, and extensor pollicis longus. Okay, here So this is the anatomical snub box, and the first the radial artery is the content, and the three muscle tendon. Two are extensor pollicis longus and brevis. Then another one is extensor pollicis longus. Here extensor pollicis brevis and abductor pollicis longus. These are three muscles: extensor pollicis brevis, abductor pollicis longus, and the laterally extensor pollicis longus. This is called anatomical snub box, and the content is radial artery. Now the I already said that the axillary artery. Axillary artery has three important parts: first part, second part, and third part. First part has single artery, superior thoracic artery. Superior thoracic artery. Another one is the thoracoacromial artery. It is also gives supply to the breast. And the lateral thoracic artery is also supplied to the breast. So internal mammary artery, thoracoacromial artery, and lateral thoracic artery. These also give supply not only to the chest wall but also to the breast. Subscapular artery is the third branch. Then the anterior circumflex humerus, posterior circumflex humerus. So subscapular artery, one of the largest branch. Okay. Then the superior anterior humeral, circumflex humeral, posterior circumflex humeral. The third part has three branches. Second part thoracoacromial, lateral thoracic, and the first part superior thoracic. Okay, just try to remember. Here you can see the superior thoracic artery, first part. Second part is thoracoacromial artery, then subscapular artery. A full area is supplied by subscapular. Another one is the lateral thoracic. So here are two branches, but here is the two branches. One is the lateral thoracic, they give supply to the thoracic wall, and this is called subscapular artery. These two artery comes from second part of the axilla, and third part is three things: anterior and posterior circumflex humeral artery, and thoraco and subscapular artery. Okay. Second part has thoracoacromial artery and superior thoracic. First part thoracoacromial and the lateral thoracic. So lateral thoracic is the second part, bolded. Another one is this subscapular and anterior circumflex humeral artery, posterior circumflex humeral artery, and one is subscapular. Okay, so subscapular, this is the third branch, contains three branches: superior thoracic single branches, and the middle part has a second two branches: thoracoacromial artery and the lateral thoracic artery. So it is not needed. Now the brachial artery. It is one of the important arterial supply, which is a continuation of the axillary artery. Here the axillary artery, which is act as a brachial artery. Okay, if I take in short here, see, this is the axillary artery. It goes, then it is called the brachial artery, largest branches, and the most largest branch of the brachial artery is the profunda brachii artery. So here the brachial artery begins at the lower border of the teres major. Now in the cubital fossa is separated median cubital vein by orbital aponeurosis. The long head of triceps radial nerve profunda brachii intervening. Basilic vein is containing the most proximal aspect of the cubital fossa, lies medially. An ulnar artery is called, so there is a relationship, another one. Anteriorly, it is overlapped by the medial border of the biceps, and it is crossed by the median nerve in the middle of the arm. Okay. Ulnar artery starts from middle to the antecubital fossa, deep to the pronator teres, flexor carpi radialis, palmaris longus. It is a branch, anterior interosseous branch. You have to know that ulnar artery has anterior interosseous artery. Now the radial artery. So this is an ulnar artery here, veins of the basilic vein. It is joined by the medial brachial vein before the draining of the axillary vein. So here it was joined to the medial brachial vein, draining the axillary vein. Basilic and cephalic vein both provide the main pathway of the venous drainage of the arm. Originate from medial side of the dorsal venous work. At the lower border of the teres major muscle, the anterior and posterior circumferential humeral veins feed into it. So here this is a medial cubital vein, this is the basilic vein, this is the cephalic vein. So cephalic and basilic united with the axillary vein. Okay. Now the nerve supply. The median nerve, most flexor of the forearm and the thenar muscle of the hand. And muscularly all muscles of anterior compartment of the arm. Radial all the posterior compartment of the arm and forearm is supplied by the radial nerve. And the ulnar, most intrinsic muscle of the hand, flexor carpi ulnar, is the medial half of the digitorum profundus. This is intrinsic muscle of the hand, flexor carpi ulnaris, and median half of the flexor digitorum profundus. Okay, you must think 4 things. Okay, posterior surface is by radial, flexor forearm of the median, and the all muscle anterior compartment, that is the seen here, all are the musculus cutaneous, and the ulnar is intrinsic muscle of the hand, that is T1. It is the nerve root value as of dermatom is a T1. Here see the T1 ulnar nerve. So here the median portion, the ulnar portion. Okay, so must know, very important. Now the brachial plexus. Brachial plexus start from the C5 to T1, ventral rami of the C5 to T1. That is real tiger drinks cold beer. Okay, say medial to lateral. This is called the real tiger drinks cold beer. Real root, teeth trunk, teeth division, C cord. C is the last part of the brachial plexus. So the distal nerve, that is radial, axillary, median, those all started as a cord, from the cord. So roots, that is present in the posterior triangle, pass, that is brachial plexus present in between the scalenus anterior and medius. It is very important. And the trunks located posterior to the medial third of the clavicle, lower truncal plexus over first rib, posterior to the subclavian artery. Very important. Okay, lower trunk, that is T1, CA to T1. That is also called the lower trunk, passes over the first rib and posterior to the subclavian artery. So then in the first rib groove, in the front subclavian vein, then middle subclavian artery, and posteriorly lower trunk of the brachial plexus. So here the brachial plexus 5, 6, that is called the median nerve, musculocutaneous nerve. Then also 5, 6, 7, 8. Yes, 5, 6, 7, 8. Those are the axillary nerve, but radial nerve. Ulnar is CA to T1. That is long thoracic nerve. It goes downwards, and that is the brachial plexus. You must know that it wraps the axillary artery. Now the posterior cord. Here the specifically posterior cord is important. How many nerves come from the posterior cord? That is axillary, radial first, then the thoracodorsal, that is nerve to latissimus dorsi, and the subscapular, upper and lower. Okay, upper lower subscapular nerve, thoracodorsal nerve, upper and lower subscapular nerve, thoracodorsal nerve, axillary and radial nerve. Now the musculocutaneous nerve, 3 muscles, coracobrachialis, biceps and brachialis muscle. Axillary, that is deltoid and teres minor, I already said that. And radial, triceps, brachioradialis, extensor carpi radialis longus and brevis. Extensor carpi radialis longus brevis, then brachioradialis and triceps. Posterior interosseous, that is supinator, extensor carpi radialis, carpi ulnaris, extensor digitorum, superficial minimi, abductor, pollicis longus. These all already discussed. I already discussed it. Musculocutaneous nerve lines between the biceps brachii and brachialis in the lateral arm of the forearm is important. It is a branch of lateral cord of the brachial plexus. Penetrates the coracobrachialis muscle. Biceps brachialis, biceps brachii, brachialis, or coracobrachialis. The three things. Coracobrachialis, biceps brachii, and the brachioradialis. Must know. This is the must know. Now median nerve, their supply. So I already said the loaf. I already told you where I would say. I did say it. Loaf, lateral two lumbricals, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. Two brevis, abductor and flexor, and opponens pollicis, two lateral lumbricals. Those are supplied by median nerve. And the sensory over the thumb, lateral one half, palmar aspect, the cutaneous innervations. In the forearm, pronator teres, flexor calvi radialis, palmaris longus, flexor superficialis, flexor quadratus, flexor pollicis longus, flexor digitorum profundus, radial half. All supplied by median nerve. It is the largest branch. It is also called the laborer nerve. Damage to the wrist. The carpal tunnel syndrome. Median nerve is entrapped. That's why carpal tunnel syndrome occurs. Paralysis of the wasting thenar eminence. Include opponens pollicis. Damage to the elbow, unable to prone forearm. If there is a fracture, supracondylar fracture or damaged elbow, in that case pronation, that is pronation. This is the supination, and pronation is impaired. Weak flexor, wrist flexor. So wrist flexion is weaker because every flexion muscle comes from the medial epicondyle. So if elbow is ruptured, then flexion of the wrist will be weak. Then the ulnar deviation of the wrist. If ulnar deviation occurs here, that's why there is a median nerve problem. That's why ulnar nerve is upper hand. In that case, ulnar deviation occurs. Interossei is the branch of the median nerve. It is a branch of median nerve. It is a pincher movement of the thumb and index finger. Must know. It is called the must know pincher movement, like this. If I say this is a piece of papers, so if I use to thumb and the index finger, is called the pinching movement. If I pull down, I can't, because my median nerve is powerful, my interosseous nerve is powerful. This is called the pinching movement. And now it's also called the Fromet test. Fromet test is also called. Now the C8 or T1, that is intrinsic muscles of the hand. So medial two lumbricals, that was lateral two lumbricals. Now the medial two lumbricals supplied by median nerve, adductor pollicis, flexor digitorum profundus, flexor ulnaris, interosseous A. Now the supply also, I always said that. So damage to the wrist, effect of injury, it is very important. Wasting and paralysis of intrinsic muscle, that is claw hand. If ulnar nerve is injured, then wasting and paralysis of the hypothenar muscles, and the loss of sensation medial 1.5 fingers. Damage to the elbow, if damage to the, then clawing of the 4th and 5th digit, very very important. It is VBP, very very important. Very very important. Damage to the elbow in the elbow region. That's why 4th and 5th, that is 1, 2, 3, 4 and 5th, these two digits become claw like this. That's why damage to the elbow here. Ulnar nerve is damaged in the elbow. In that case, 4th and 5th digit is very common, and the radial deviation of the wrist, it is also important. So wrist will become this. If ulnar nerve is damaged here, in that case 4 and 5th digit will be weaker, and radial deviation of the wrist. This is how it goes. Median nerve, ulnar nerve. So here the radial nerve, Radial nerve supply the triceps, anconeus, brachioradialis and extensor carpi radialis longus. We all know that. And another posterior interosseous branch, it gives to extensor surface, extensor carpi digitalis, extensor digitorum, extensor indicis, supinator, extensor digiti minimi, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus. Okay, all are supplied by the posterior interosseous, is the branch of radial nerve, and anterior interosseous is the branch of median nerve. Shoulder, long head of triceps, minor effect of shoulder stability abductions, triceps, loss of elbow extensions, forearm, supinator brachioradialis and extensor radialis longus and brevis, weakening of the supination prone hand, elbow flexion, intermediate prone injury. Just it is very important. Now the joint, shoulder joint is a synovial joint, that is glenoid labrum is a fibrocartilaginous rim, free edge, long head of the tricep attached to the infraglenoid tubercle, and the long head of biceps arises from the supraglenoid tubercle. Shallow synovial groove, unstable joint is capable of wide range of movements, that is circumductial movement here like this. The fibrous capsule is very important. Now, who are the abduction, adduction, circumduction movements? What bones, what muscles is involved? That is flexion, anterior deltoid, pectoralis major, biceps and brachioradialis. That is flexion of the shoulder. Now extension, deltoid, teres major, latissimus dorsi. Adduction, that is here. This is abduction, this is adduction. So abduction like this, adduction like this. Abduction done by deltoid and supraspinatus. Medial rotation, that is subscapularis, anterior deltoid, this kind of things. Lateral rotation is not needed. Now the last topic, that is the breast. So breast is a modified sweat gland present just along, attached with the chest wall. So breast is attached with how many muscles? It is important things. That is pectoralis major, serratus anterior and the external oblique. 3 muscle, they get together as a, they will hang out with the breast. Okay, it sounds odd, but breast is stayed with these 3 muscles. Nerve supply is the intercostal nerve, and the artery supply is the internal memory, that is 60%, external memory laterally, thoracoacromial artery, anterior intercostal artery. Venous is superficial venous plexus, which goes ultimately subclavian, axillary or some are intercostal vein. Lymphatic drainage, very important. Axillary node 70%, another things in internal memory chain, and the deep cervical supraclavicular nodes in lateral space. This is the axilla. Now the axilla, medially, here medially the chest wall, laterally the humeral head and floor, that is floor, subscapularis, anterior aspect, pectoralis major muscle and the clavipectoral fascia, very important. Here the long thoracic nerve, or it is called the nerve of Bell, 5 to 7, winging of scapula, without it. Thoracodorsal nerve, innervated vascular latissimus dorsi. Axillary vein lies apex of the axilla, continuation as a basilic vein, becomes subclavian vein at the outer border of the first rib. Just remember, very important. Intercostobrachial nerve, very important. During breast surgery, intercostobrachial nerve sometimes injured. Okay, that's why you must know about the transverse axillary lymph nodes. Axillary surgery, if you do axillary surgery without knowledge of intercostobrachial nerve, you might injure it. Cubital fossa, this is the middle cubital vein, basilic, cephalic. Here the tendon of biceps brachii, which is humeroradial joint, cubital fossa here, bicipital aponeurosis. So here see the relationship: artery present in the laterally, then medially, median nerve, artery, nerve, and then another nerve. Okay, it lies above the tendon. So you can see here, this is the surface anatomy. You can see the surface. By watching surface or assessing the surface, it is another mode of teaching, mode of learning, or mode of teaching. If you have the knowledge about the surface anatomy, you can know what may be the structures present here. You know that. So that is all about today's presentations, and it is the first tutorial class of MRCS, that is Study with me. So I hope you enjoy my videos, and you also have interest on MRCS preparation. So it is very easy if you stay continued with the video lectures along with the regular studies. I hope you will do better in the exam. Okay, thank you very much. Till then, tada.